Welcome, everyone, to Vet NeuroJar, the podcast where we pop the lid on the fascinating world of veterinary neurology and orthopedics.
Today, we're diving deep into a topic that affects many of our canine companions, especially those larger breeds: lumbosacral instability, specifically looking at the surgical options for stabilizing the lumbosacral spine in dogs.
Exactly. We'll be drawing from a recent review that examines the challenges and advancements in this area of veterinary medicine. It's a condition that can lead to significant pain and mobility issues for our furry friends.
So, let's start with the basics. What exactly is the lumbosacral junction, and why is it so prone to problems?
Great question. The lumbosacral junction is where the last lumbar vertebra, L7, meets the sacrum, S1. This area is incredibly mobile, allowing dogs to flex, extend, rotate, and laterally flex their lower back. However, this mobility also makes it susceptible to degenerative changes and injuries, leading to a condition called degenerative lumbosacral stenosis.
DLSS, that's the key term here. So, what happens in DLSS, and what are the telltale signs that owners might notice?
In DLSS, the intervertebral disc between L7 and S1 starts to degenerate, often due to excessive mechanical strain. This degeneration triggers a cascade of problems, including stiffening of the disc, thickening of the surrounding ligaments, and narrowing of the space where the nerve roots exit the spinal canal.
And that narrowing leads to nerve compression, right? What are the clinical signs?
Exactly. Nerve compression is a major issue. The signs can range from mild pain and reluctance to exercise to more severe neurological deficits like hind limb weakness, paralysis, urinary and fecal incontinence, and even tail paralysis. It's a spectrum, and the severity depends on the degree of nerve compression and instability.
It sounds incredibly painful and debilitating. So, what surgical options are available to help these dogs?
Well, there's a range of surgical techniques, and the choice depends on the individual dog's specific needs. The primary goal is to relieve pain, eliminate spinal instability, and prevent further neurological decline.
Can you walk us through some of the common surgical methods?
Absolutely. One common approach is dorsal laminectomy and stabilization.
What does that involve?
During a dorsal laminectomy, the surgeon removes a portion of the L7 vertebra and sometimes part of the sacrum to relieve pressure on the cauda equina, which is a bundle of nerve roots. If a herniated disc is contributing to the compression, a partial discectomy is also performed to remove the problematic disc material. In addition, a foraminotomy or facetectomy might be done to further decompress the exiting nerve roots.
Okay, so that's the decompression part. What about the stabilization?
Stabilization is achieved using various methods to fuse the L7 and S1 vertebrae together. This can involve transarticular screws, pedicle screw rod fixation, PSRF, intervertebral cages, or even pins and screws with a special cement called polymethyl methacrylate, PMMA. Bone grafts, either from the dog itself or synthetic, are often added to promote fusion.
So, several options available to help achieve stability. Let's talk a little bit more about pedicle screw rod fixation, or PSRF. It was mentioned as a stabilization method.
PSRF involves placing screws into the pedicles of the L7 and S1 vertebrae, which are then connected by rodstow, create a rigid structure. It aims to immobilize the joint, reduce pain, and slow down further degeneration.
What are the benefits of PSRF?
PSRF is recognized as an effective stabilization method, especially after decompression surgery. It helps restore normal vertebral alignment and can relieve pressure on the nerves. Some research suggests it might even slow down the degenerative process.
That sounds promising, but are there any downsides?
Definitely. PSRF is a technically demanding procedure that requires significant surgical experience. Incorrect screw placement can damage nerves, blood vessels, or even the spinal cord. There's also a risk of implant-related complications like screw loosening or breakage. And importantly, PSRF doesn't guarantee bone fusion, so bone grafting is often needed.
It sounds like a complex procedure with potential risks and benefits that need to be carefully weighed. Are there other stabilization techniques?
Yes, another option is transarticular screw fixation. This involves placing screws across the facet joints of the lumbosacral spine after a laminectomy and discectomy. The goal is to limit motion and reduce pain.
What are the advantages of this technique?
Transarticular screw fixation is relatively simple and doesn't require specialized surgical equipment. Some studies have shown good clinical improvement in a significant percentage of dogs.
And the disadvantages?
This technique has a higher rate of technical failures, like screw pullout or breakage, compared to PSRF. It also doesn't completely immobilize the spinal segment, which can increase the risk of implant failure. Bony fusion is also not reliably achieved with this method.
So, it's a less invasive option but potentially less stable. What about dorsal locking plates and string of pearls, SOP plates?
These plates are designed to span the lumbosacral junction and provide rigid fixation. SOP plates can enhance stiffness at the junction, while dorsal locking plates are often used with PSRF to improve stability after decompression.
What are the drawbacks of using plates?
There can be issues with inadequate stiffness, screw loosening, and the need for reoperation. The complex anatomy of the spine can make it difficult to fully adapt the plates to the vertebrae.
So, with all these different surgical options, how does a veterinarian decide which one is best for a particular dog?
That's the million-dollar question. The choice depends on several factors, including the severity of instability, any other spinal problems, the dog's size and breed, and the surgeon's experience and preferences.
It sounds like a very individualized decision-making process. Tell us more.
Absolutely. And that leads us to an exciting area of advancement, custom-made implants. With advances in 3D printing, we can now create implants that are precisely tailored to a dog's unique anatomy. This is particularly helpful for dogs with unusual spinal configurations or severe degeneration.
How does the process of creating a custom-made implant work?
It starts with a CT scan of the dog's lumbosacral region. The scan data is then used to create a 3D model of the spine, and an engineer designs a personalized implant and surgical targeting device based on this model. The veterinarian reviews the design, provides feedback, and the final implant is 3D printed.
That's incredible. What are the benefits of custom-made implants?
Custom implants can provide a better fit, function, and integration with the surrounding tissues. This can lead to improved surgical outcomes, especially in challenging cases.
Are there any challenges associated with custom-made implants?
Yes, it's crucial to ensure consistent quality throughout the entire process. Since each implant is unique, maintaining uniformity in areas like polishing and mechanical strength can be challenging. It also requires specialized skills from highly skilled engineers.
It sounds like the collaboration between the veterinarian and the engineer is absolutely essential.
Absolutely. The veterinarian brings the clinical expertise, while the engineer ensures the implant meets the clinical requirements and adheres to safety and regulatory standards.
It's amazing how technology is transforming veterinary medicine. Now, shifting gears a bit, the review also mentioned the importance of ISO standards. What are those, and why do they matter in this context?
ISO standards are internationally recognized criteria for ensuring the quality, safety, and efficacy of medical devices and implants. They cover aspects like material biocompatibility, mechanical integrity, and manufacturing processes.
So, they're like a quality control checklist for implants?
Exactly. By adopting ISO standards from human medicine, we can ensure that veterinary implants meet high-performance criteria, minimizing the risk of complications and improving patient outcomes.
That makes perfect sense. But are there any challenges in applying human ISO standards to veterinary medicine?
Yes, because the human ISO standards may not always align perfectly with the unique anatomical and biomechanical needs of animals, potentially leading to implants that are over-engineered and more expensive. Also, adapting these standards requires effort, as they are based on human data.
So, there's a need for continued development of veterinary-specific standards.
Absolutely. But in the meantime, using human ISO standards provides a valuable foundation for ensuring the safety and effectiveness of veterinary implants.
This has been incredibly informative. It's clear that lumbosacral stabilization in dogs is a complex field with a range of surgical options and exciting advancements on the horizon. Now, I think we need to pause and ask you a question before we move on to our outro. Given all the surgical techniques available for lumbosacral stabilization, what do you see as the most promising area for future research and development?
That's a great question. While there's no single best technique for every dog, I think the biggest potential lies in custom-made implants and surgical guides created using 3D printing.
Why is that?
Because these personalized solutions allow us to address the unique anatomical challenges of each patient, potentially leading to better outcomes and reduced complication rates. As imaging technology and 3D printing techniques continue to improve, I think we'll see even more widespread adoption of custom implants in veterinary orthopedics.
I completely agree. It's exciting to think about the possibilities. Before we continue, I think I should ask you a question as well. I am curious, with the cost of implants, is it really a reasonable option for most dog owners?
Another great question and a difficult one. This is a very large consideration for many dog owners. Many factors are in place that can reduce costs. Vet schools may perform the surgeries for a lower-cost nonprofits, may be able to provide financial assistance to pet owners. Pet insurance can be helpful.
Thanks for answering. That's all the time we have for today.
Thank you for tuning in to Vet NeuroJar. We hope you found this discussion on lumbosacral stabilization in dogs informative and engaging.
And remember, if you notice any signs of back pain or neurological issues in your dog, consult with your veterinarian right away. Early diagnosis and treatment are key to a successful outcome. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.